Thank you very much, dear Mr. President, dear Mr. Director, Your Excellencies, ladies and gentlemen, dear guests. I am honored to be standing here in front of you at the 2016 edition of the Bucharest Forum dedicated to healthcare. I'm also taking this opportunity to pass on the greetings of our Health Minister, Mr. Vlad Voiculescu. The themes that you will be addressing and debating today are extremely thought-provoking. And we're speaking about technology in health, stakeholder engagement, sustainability, social resilience. These are all topics around which fruitful exploration can lead to the advancement of our healthcare system. The mission of the institution that I'm representing, the Ministry of Health, is to maintain and improve the health of all Romanians, as well as to deliver performant healthcare that is adapted to our needs. The mandate of our health minister is very short, as you all know, to compensate. Our work days at the Ministry of Health are very long and intense. We are working on solutions for a better healthcare system, but most of these solutions will produce effects only down the road. Does this mean that we are discouraged? No, we're not, under no circumstance. This May, our health minister and our colleagues, we embarked on a journey built around the vision of our health minister, Vlad Voiculescu. Is that vision achievable? We believe it is. And to prove that, we are working every day to try to change the healthcare system from within. In the minutes to follow, I would like to, for you to allow me to share some of the things that my colleagues and I at the Ministry of Health are working on. And before starting that, I would like to say that some of our colleagues are here in the room. Some of them will be panelists. We have here with us Dr. Alan Emerenko, Dr. Raluca Teleanu, Dr. Bogdan Pana, Mr. Adrian Gheorghe, and they are only some of them. I was telling you that I want to present what we are doing to prove that we are trying to bring a change in our healthcare system from within. First of all, we are performing a comprehensive mapping of healthcare needs, and this is the first to have been done in Romania. We are also working on improving the access to medicines with the assistance of a stellar team of national and international experts. We are identifying methods to strengthen primary care and do a paradigm shift towards a more patient and community-oriented approach. We are improving the selection and evaluation of hospital managers so as to ensure that performance and competence are the criteria based on which we select them. We are paving the way to building brand new hospitals, and we have 3 regional hospitals that will be built in Iași, Craiova, and Cluj, and 2 hospitals in Bucharest. We are helping hospitals to better prevent and manage hospital-acquired infections. We are making it easier for patients to provide their feedback on the care that they are receiving. And perhaps, even more important than this, we are investing in human resources for health and the people that are working in our healthcare system. You all know that Romania is losing health professionals, talented, devoted health professionals. With every doctor or nurse that is leaving the country, this means that several hundreds or even thousands of Romania lose the opportunity to have access to health professionals, to timely and high-quality care. In order to prevent this happening in the future, we are working for the first time on developing a human resources for health strategy in the Romanian healthcare system. Of course, strategies are of no help if they are not being implemented. And in order to do that, we are developing, together with the strategy, a plan of actions that will bring more reality to this strategy. And a key point to this strategy is providing the health professionals the respect that they deserve. This means a lot of stuff. This means the attitude that we have every day towards health professionals, towards the people in the healthcare system, but also it means creating the opportunity for health professionals to perform in newly built or renovated hospitals. It means paying them at the level of the value that they deserve and that their work is deserving. It means doing every effort to insert young health professionals in places of need, but ensuring in the same time that they get the respect and the satisfaction that they deserve working in those places. We already started increasing health professional salaries. We already have taken some measures to increase the payment that they receive for their shifts. Is this enough? No, it's not, but it's a beginning, and more measures will follow soon. Nonetheless, this is only a small part of what we are doing and working at the Ministry of Health. But all this brings us to a more philosophical question. What are we all in the healthcare system working for? Are we working for managing sickness? Or are we working for producing health? Because these two things are completely different. Our vision is to shape the Romanian healthcare system in such a manner that it will produce health, not only manage sickness. Nonetheless, we have to be honest and admit that we are not producing health yet. Not yet. We at the Ministry of Health are not only happy that such events as the one happening today are taking place in Bucharest, but also eager to discuss with you the conclusions of the meetings. And I can assure you that we will take into account any concrete proposals that will be issued from the lively debates that you will have today. We all know that our healthcare system is far from being perfect. And this could be a bad news because there is beauty in perfect things. But on the other hand, there is beauty in doing every effort to take imperfect things and help them be a little better. I am hopeful that the event that will take place here today will contribute to this effort to improve what is something that is imperfect and make it a little better. Thank you very much.